Greetings to everyone. Today we will be talking about heart attack. So coming to the working of the heart is basically a muscular organ which contracts almost to the tune of 72 beats per minute approximately. So if you calculate over the days, over the hours, over the year, it contracts millions of times and gives blood to the various organs, which in turn gives oxygen and nutrition to the organs. It is a central part of the body, or you can say engine of the body, which carries it. So if it is not well, then things go wrong and quite for the whole body, because the perfusion to every organ is impaired and each and every organ starts failing. So heart attack is basically the heart is failing. The attack means it is a sudden attack or insult to the heart. So this is caused by the occlusion of the coronary blood flow. That is, the blood supply to the heart itself is occluded or impaired. So this impairment of coronary perfusion or blood flow to the heart makes the heart depleted from the nutrition and oxygen, and still the heart is contracting despite receiving less nutrition or no nutrition at all, and the muscles are dying. We call it necrosis, apoptosis, and the dying muscles try their best to contract still. Because the heart cannot stop working, that's why once the occlusion sets in, the blood supply to the heart stops, the death of the heart muscles occurs at a very rapid pace. You can say within first 20 seconds the cell starts to die. There are billions of cells in the heart that contracts in a very synchronous fashion, and that causes the pumping of the blood flow to the other organs. So if you see the heart, the major part is ventricle, the left ventricle, which supplies the blood to the whole body, and there are 3 blood vessels which supplies blood flow to that all organs. The blood supply also pertains to the electrical supply of the heart. The electrical supply is also perfused by the blood vessels, and they also it can also be hampered in some cases, like the right coronary artery once get occluded, the blood supply to the current of the heart is also gone, and so the heartbeat can also become irregular. Along with that, there is inflammation in the heart, and that inflammation causes irregularity in the heartbeat, which can produce ectopics, or which can cause a sudden sustained irregular heart rhythms, and these irregular heart rhythms can cause sudden stoppage of the heart. So that's why this is one of the major causes of sudden death in heart attack even before the patient comes to the hospital. So since we now know that it is the blood supply to the heart which is impaired or which is gone, that causes the heart attack, what causes actually this blood supply to deteriorate? There is a blockage in the heart vessels which is caused by the lipid deposition in the blood vessels which supplies to the heart, and this lipid deposition is because of the injury to the endothelium, which can be because of various factors, and these are important to know, as we can treat them or modify them and prevent the heart attack. The endothelium which lines the vessels is subjected to the insult by various risk factors. Some of them are modifiable, like smoking. Smoking can cause endothelial dysfunction and increase the risk of heart attack by 2 times at least. There is a high chances of thrombus formation. The nicotine in the smoke causes the vasoconstriction of the coronary vessels and increase the platelet aggregation. And this altogether provokes the chances of myocardial infarction by occlusion of the coronary vessel or blockage of the heart vessel by sudden formation of thrombus in them. So another risk factor, which is diabetes and hypertension. Both of these risk factor causes endothelial dysfunction and injury, which makes the lipid deposition more likely, and also the chances of rupture of the lipid plaque, that is the lipid which is deposited has a cap over it, which is the fibrous cap. This fibrous cap can be thin or thick, and whatever it may be, thick or thin, it can rupture. The chances are more in a thinner cap, but still thicker cap can also rupture. What causes them to rupture is inflammation. This inflammation can be because of smoking, this can be because of some rheumatoid arthritis or inflammatory condition going in the body. Stress itself can cause increase in the inflammatory cells, and these inflammatory cells can degrade the fibrous cap, and which can rupture the this atheroma. The lipid which is exposed after the rupture of that fibrous cap is actually procoagulant, or you can say the blood will stick to it very quickly, and blood clot will form in the artery within just few seconds. So the artery which has just 10% blockage because of the lipid deposition can go into 100% blockage within 5 seconds. So patient who was previously healthy and was not actually a patient, he just becomes irresponsive, or he can go into sudden arrest because of the occlusion of the coronary artery, sudden blockage of the artery within 5 seconds. The clot can form within 5 seconds, from 10 to 100 within 5 seconds. So this sudden blockage does not give time to the heart to form the collaterals, that is small vessels which open up. If the artery is slowly blocked basically by the lipid deposition, then the heart has got the opportunity to open the collateral supply. So in that cases, the patient does not feel sudden chest pains at rest or severe symptoms at rest, but feels chest discomfort or breathlessness on exertion. And there is no heart attack actually happening, but that anginal symptoms are impairing his quality of life. But the slowly collaterals open up, and the patient does not actually get a impairment in LV function. The heart function remains preserved despite the artery getting 100% blocked, because the artery was slowly blocked. But in heart attack, the situation is a bit different. The artery was open and it suddenly blocks because of the clot formation, and this clot has been formed on the lipid plaque which has been exposed after the rupture of fibrous cap or erosion of the cap. So this is the most common mechanism leading to heart attack, and the rupture has been caused by smoking or diabetic status. The chances of depositions are more in hypertensive patients because of the endothelial injury, and furthermore inflammatory conditions like rheumatoid arthritis and stress, as I elucidated before. So how can we prevent this heart attack? Basically we need to take our lifestyle to a better approach. Then only we can tackle these lifestyle diseases. And the lifestyle includes here basically the how we eat and how we exercise and how we live basically. So the stress is the center point here, because the stress can lead to increased sympathetic activity, increased heart rates. It can lead to vasospasms, increased release of catecholamines. It can cause increased inflammatory activity in the atheromatous plaques and can cause rupture of the plaques also. And the stress, chronic stress, has a kind of a catecholamine stress on the myocardial cell, which can lead to their fatigue also. So the stress has to be avoided. Next, habits like smoking, alcohol should not be the integral part of our lifestyle. Smoking has to be absolutely refrained. There are no benefits of smoking. We all know that it is hazardous. It is labeled as deadly by the government of India also, and so we should abstain from smoking as far as possible. Alcohol should be avoided also, because it can lead to more chances of arrhythmia. The chances of atrial fibrillation are more. The weight gain is more. There are not much documented benefits, at least in Asians, for alcohol. And then coming to the dietary part of lipids, the lipids have been much of a controversy in this actually. We all know the saturated fatty acids have to be avoided, trans fatty acids to be avoided. Saturated fatty acid should contain less than 7%, and we should increase the intake of MUFA. But all lipids are not bad basically. So we are not saying that you should not consume lipid or lipid free diet is good. That has not been shown to have a benefit. As far as the diet is concerned, the Mediterranean diet is the only diet which has shown excellent prognosis, and it contains, if we look at it, it contains a lot of salads and vegetables, green leafy vegetables, and then avoid as much as refined food is concerned. It contains fish, white of an egg basically, and so all these are good. And dairy products should not be in abundance too much of also, as Indians are very fond of, and so is the juice basically that is seen at every corner, and we think it is very healthy. Basically the roughage of the fruit is just thrown away, and the sweetened part is given to us in the juice. It is only good for those who cannot digest the whole fruit. So it's a fruit which is actually good integral part of our lifestyle. So we should consume green leafy vegetables, if possible white of an egg, fish, and diet should also contain in balanced amounts of fruits, at least 2 servings, And the activity exercise is another important part. 45 minutes of exercise daily, at least for 5 days a week. This is a bare minimum, and we should actually strive for even better. It has been shown that those people who walks less than 6,000 steps per day are actually more prone to illnesses, just not cardiac but also cerebral and other vascular illnesses also. So if we look at the vascular age is different from the chronological age of the patient, that is, or the biological age of the patient. A patient may look like 60, but he may be actually 50, and his vascular age may be even 70, though his as per his date of birth, his age is only 50. But this happens because our system ages in a different fashion, just not based upon our date of birth. It ages as per our lifestyle. So it is our lifestyle which forms an integral part how we age. If we want to age like a healthy or fine wine, then definitely we have to take care of our lifestyle. The salt should be contained to the minimum. Basically, we can if we go to the ancient times, basically the salt intake was higher because it was found in abundance in the nature, but the salt was not added over top of that. The salt was refined after the rocks, and just after from the rocks and the waters afterwards as the evolution happened. So overall salt intake was less in that time, and the age of the persons were high. And so till a certain time, that is till 4 or 5 gram per day, it's acceptable. But once it goes over and above, some people are salt sensitive. Their blood pressures remains high because of the increased salt intake. So I suggested regarding the diet, and we talked about regarding the exercise and the stress. All these 3 components are important, along with the 4th pillar, that is sleep. Good sleep is necessary to have to rest the body. As we see the computers keep on working. We have to switch off the computer. If it keeps on working for a long time, we don't switch it off, definitely it will heat up and burn away. So same ways our body also needs a rest, and if our sleep is sound and good, the time, not only the time or the quantity, but the quality is also important. There is a number of sleep disorders which can cause hypertension, blood pressures, raised blood pressures. So a good sleep is important, along with we need to look at the bariatric part, that is the weight part of the person. If we should maintain the ideal body weight or healthy body weight, which we can get from the various equations or graphs, but roughly speaking, you can say around 1 kg to 1.2 kg per inch basically. So as per the height, and we need to have adequate body proportions. If there is a central obesity, that is the abdomen is way above the muscles in the arm, definitely the lean body mass is less in this case, and the adipose tissue is more. So this person is more prone to the cardiac diseases than who is lean, who is having a lean mass more. So we need an adequate distribution, good distribution of the weight also, not just the right weight. So the exercise, the diet, and abstaining the chronic substance abuse, and then as far as possible to stay away from the stress, or use the stress for a positive productivity rather than getting too much into the stress, worries, and not being able to do the work. Basically till the time the stress increases your performance, it is good, but after that it actually impairs the performance too much. If we go into that deep worries and all that, and we are not able to do anything, and that is affecting our health also. So if we keep a healthy lifestyle, we hopefully can live longer. We can prevent these heart attacks to a large extent. So as the development is happening on various fronts, technology, agriculture, industrial, and everywhere, so should it happen in the healthcare also, I believe. And our development in another fields should not hamper the health development. So healthcare has to be central part of our evolution. So we need to take care of our lifestyle, and it should not be let to be disturbed by other developments or technological advancements. So good exercise, good diet, and abstaining from substance abuse. Moderation of salt intake can go a long way to prevent all these lifestyle illnesses, which include not just heart attack but other cardiac, cerebral, and other illnesses also. That's all from my side. I hope this message can help to larger people, and it is for greater good. Thank you.